Good morning, ladies and gentlemen. Today we are studying the course of forensic medicine. There are lectures to be delivered and some classes, 10 classes and 8 lectures. This is the first lecture, kind of introduction. First of all, I'd like to welcome you on the course of forensic medicine. These 8 lectures will be dedicated to some specific aspects, specific topics of forensic medicine. This is not the entire course. There will be some topics not described in a lecture, not discussed while the lectures, but discussed while the classes. Anyway, some materials will be provided to you to support your studies. And these lectures, they also might be very helpful to get prepared for classes and to answer some teachers' questions. So, welcome to classes of forensic medicine. And so today we are discussing forensic medicine, essentials of forensic Thanatology. First of all, what is Thanatology? We will discuss it in details further on, but first of all, I'd like to say that Thanatology is the science about death and dying, process of dying. But as you know, forensic experts, forensic medical professionals, they have dealt with various cases related to some kind of medical issues arising during the criminal investigation. Among them, there are forensic examination of the dead people, dead bodies. So, does that mean that every dead body, all the bodies must be examined by the forensic expert? The answer is no, definitely not. But there are some cases which are mandatory, which require some kind of obligatory forensic examination. Forensic examination must be provided in case of violent death, like homicide, suicide, or accident. In case of sudden death, some kind of suspicious death, without any evidence, without medical supervision, then the cause of death is absolutely unknown and might be very surprising. The second reason, mandatory reason for forensic examination, is the examination of the corpses of unknown people and corpses of the newborn babies. Unknown people, then the body is found somewhere, doesn't matter what exactly the place where it was found, but we have no idea who that person is. In this case, forensic examination is mandatory. Newborn babies, even if they die within the medical facilities, they also require some forensic examination to answer specific questions. Forensic examination is appointed also in mandatory cases like death within 24 hours in a hospital, within 24 hours after hospitalization. Then the patient had been admitted to the hospital but had died immediately. In this case, forensic examination is mandatory. Any other cases of death within the hospital under medical supervision, then relatives or some related persons, they have questions about the reasons of death. And forensic examination is mandatory in case of medical malpractice, like medical errors. So we proceed to discussion of forensic thanatology itself. Thanatology is the science that studies process of dying and changes occurring after the death. The word thanatology comes from the Greek word thanatos, which was the name of the god of death in ancient Greece, and the word logos, which means science, studying something. So Thanatology studies death and dying. What is death? It's a kind of philosophical issue, medical issue, the issue of art. So different specialists from different areas, they could provide different definitions. From the medical point of view, we define death as irreversible process of the cessation of the main vital function. To diagnose death, we use so-called the vital trigon of Bichat. It was introduced to the medical practice 2 centuries ago, but it's still useful, it's still helpful. So we conclude that the person is dead, then we see no function of the three main systems of the organism. These are central nervous system, these are cardiovascular system, and these are respiratory system. If there is a cessation of those three systems, they are not maintaining a function anymore, the person is definitely dead. In forensic medicine, we classify death. We could use the so-called biological classification or legal classification. From the biological point of view, both the death could be divided to categories like natural and unnatural death. The natural death is death which might happen due to some natural reasons like elderly age, very old age, not elderly but very old age, or some kind of immaturity. And unnatural death is death due to diseases and traumas. But from the legal point of view, judicial point of view, another classification is a bit more useful. It divides death to violent and non-violent. The violent death is the death due to some extraneous force application. That doesn't mean always a force like impact or pushing something. Any extraneous factors leading to death, they cause violent death. Non-violent death is the death due to intrinsic factors, like those from nature, natural death, death due to immaturity or very old age, and death due to diseases, but diseases with no extraneous factors as the primary cause, as the primary reason of that. In forensic medical classification of death, those two categories of violent and non-violent death are also subdivided to classes, and these classes are subdivided to kinds of death. Violent death is subdivided to three main classes. These are murder, suicide, and accident. Murder is an intentional killing. Then the one person intentionally kills another one. Suicide. Suicide is the situation that one person intentionally kills him or herself. And accident means no intention. There is no intention in accident. Yes, one person in accident might kill another one, but with no intention to do it, just by circumstances. All these classes, they could be subdivided to kinds, and these kinds, they mostly illustrate the real cause of death, like death due to mechanical damages, from mechanical asphyxia, from electric shock, or whatever else. So once again, categories of the death, the category of the death, violent death, is subdivided to murder, suicide, and accident classes. And these classes are subdivided to kinds which could represent real cause of death. Non-violent death, category of non-violent death, is divided to premature death, then the baby is born immature for different reasons. Maybe the baby which was born on the 5th month of gestation is absolutely normal for that age of development. But if the baby is delivered, the baby is born, this baby is not ready yet to survive at the new environmental conditions. This cause of death is equal to class of premature death. And physiological death. Physiological death, another kind of non-violent death, is the death due to very old age and from the death from different physiological abnormalities. The process of death is not real. Sometimes it is rapid, but sometimes it might last very long time. In this case, we could define stages of dying. We call them terminal states. Then the process of dying could be followed. Normally, we could say so-called pre-agony stage. Pre-agony stage, the initial stage of dying, which is characterized by the filiform pulse, pale or stained skin, some kind of depression of the main vital function. It might take relatively short or long time. After that comes so-called terminal break. Terminal break is the temporary cessation of respiratory function, and cardiac function also might be depressed so much so we could not even detect it by the simple auscultation or palpation. Terminal break usually do not last very long time, approximately within 2 to 4 minutes. And then comes an agony. Agony is the process of activation of these vital functions. The organism is trying to save itself, but the main characteristic of the period of agony is disbalance. All the functions are disbalanced, discoordinated. That means that the heart beats, but it doesn't have any mutual agreement with other functions. Yes, we could detect some heart beatings, but this pulse is depressed, it's very filiform. The respiration is ineffective. Nervous system sends many nervous impulses to various areas of the body, but receives no reaction. That's why agony is a kind of flash of activity of all these systems, but this activity is ineffective in most of the cases. After the agony comes the clinical death. Clinical death is the cessation of the vital functions. Primary functions like cardiac function, respiratory functions are depressed. It lasts not very long, usually within 4 to 5 minutes. It depends on the ability of the brain cells to survive with no oxygen supply. And after clinical death, if no necessary medical support provided, comes the biological death. The difference between the clinical and biological death is that the clinical death is reversible. Some medical aids, medicines, physical effects, they could restore functions of the human body. In biological death, it is the irreversible state, absolutely irreversible. There is no possibility to restore vital functions. That's the difference. Sometimes, in case of death, it is very evident, But in some of the cases, diagnostic of the death might be problematic. So we need to know signs of death, and we need to be able to diagnose it. You should remember that confirmation of the state of death, biological death, requires qualified medical skills. In this slide, you could see just the so-called possible signs of death, which are negative signs of life, like lack of consciousness, passive position of the body, pale skin, absence of respiratory movement, and so on. But think hard. Do you really believe that all these signs are evidence, pure evidence of the death? Lack of consciousness could be due to poisoning, due to brain trauma, but it doesn't mean all the time that the one is dead. Passive position of the body, then the one is sleeping. Sometimes, in some moments of the sleep, position might be passive. Pale skin, there are many reasons for it. Absence of respiratory movement. Ask yourself, are you skilled enough to check these respiratory movements properly, especially if they are depressed? The same thing is about cardiac contractions and pulse. Maybe you are just worrying, nervous enough to miss the right artery, and you are just made a mistake then measuring the pulse. Lack of response to painful stimuli, just because of the depression of the consciousness. That's why these signs represented at that slide are possible signs. They just give you a hint. Maybe this one is dead, but to confirm it, you should see probable signs and definite signs of death. To set a positive diagnosis of death, we should see we should make some tests. In this case, one test, the so-called the Bela-Glazov test, is shown. But to diagnose death with no doubts, definitely we should see so-called early and delayed cadaverous changes. The Bela-Glazov symptom, which is shown on this slide, on this picture, is the symptom which is seen within approximately 10 hours after the death. In this case, then we compress an eyeball. We do not squeeze it to smash it. We just compress it a bit. And we see the pupil shape changes to oval. But don't forget that this is just a part of the test. To see the entire test, you must release it. If the human is alive, even unconscious but alive, we see pupil becomes round again almost immediately. In a dead one, this symptom is seen, could be seen approximately after 15 minutes after the death, and we could see it by 10 hours after the death approximately. So if the one is dead, then we release pressure. We see pupil becoming, returning to round shape, but does it slowly, not that rapid as in case of a live person. Magnus test is the test which could be seen. Then we'll put ligature on the base of the finger, any finger, when we occlude veins by this ligature, but the arteries are still supplying blood in a live human. So we see the finger becomes swollen and congested. In a dead body with no blood circulation, we will not see this venous congestion. But the Magnus test is too long. It takes much time. That's why in practice it is not used anymore. The Bela-Glazov symptom is simple and it could be done easily. That's why it is useful for examination of the body at the crime scene, for example, to diagnose death. But cadaverous changes, these are definite signs of death. Early cadaverous changes, which are seen within first 24 hours after the death, they include so-called alga mortis. Sometimes it is called cooling of the body, but indeed, this is not about cooling. This is about equilibration of the body temperature with the environmental temperature. So if the environmental temperature is above the level of temperature of the human body, the dead body temperature will increase in this case, will rise. That's why do not call it cooling, better to call it alga mortis. The second early cadaverous change is a so-called dehydration of the body due to evaporation of the fluid from the surfaces. Livers mortis, appearance of the stains, darker stains at the lower portions of the body. Rigor mortis, like postmortem stiffness of the muscles, rigidity of the muscles, fixing the position of the body, and so-called postmortem autolysis. Let's discuss these cadaverous changes in details. Alga mortis usually is the reduction of the body temperature after the death, but it depends on the environmental temperature. If the environmental temperature is above the level of the body temperature will rise after the death. Alga mortis depends on the external factors. It depends on the temperature of the surrounding area, not only the ear, but on the temperature of the support where the body is laying. It depends on the humidity. The higher humidity is, the faster temperature decreases. It depends on the movement of air and the temperature of that air. If air moves fast, for example, in some windy place, cooling will go faster. It depends on clothing. It's evident if the body is wearing some warm clothes, changing on the temperature will go slower. And it depends on the medium where the corpse was found. For example, if the corpse was found in a water, and this is a cold water, this is evident that the body temperature will decrease faster. And it depends on internal factors, like thickness of the fats, due to insulation of the fatty tissue. In this case, cooling goes faster. It depends on the age. Bodies of the old people and infants, they cool faster. And it depends on the cause of death. For example, if the one had died in a state of fever, for example, 40 degrees Celsius, in this case, decreasing of the temperature will go slower. And don't forget that the initial point of this decrease is 3 degrees higher than usual. Usually we state that in room temperature, the slow motion of the air, temperature decreases to the rate of approximately 1 degree Celsius per hour. So if we measure body temperature, dead body temperature in the rectum, by the way, internal temperature, if we measure it and we found that the temperature is approximately 33 degrees Celsius and there is no evidence of death in a state of fever, we could conclude that the death occurred approximately 4 hours before. It helps us to understand timing of death. Next, early cadaverous change like dehydration. Dehydration, which takes place due to evaporation of the fluid from the surfaces, is manifested with changing of the surface characteristics. In this slide, you could see some areas of dehydration. The first picture demonstrates you the areas of dehydration of the sclera. These brownish stripes on both sides of the pupil are areas of dehydration, which are called so-called Larcher spots. This is not only the sign of death. This is, by the way, the evidence that the eyes were open after the death until a certain period. So if you found a dead body or police found but had appointed you as the forensic expert and you see Larcher spots, you could conclude that the eyes of the dead body, eyes of the cadaver, were open for at least few hours after the death. The middle picture demonstrates you a little abrasion on the chest, which became dehydrated in approximately 1 day after the death. Such abrasions, such very superficial abrasions, might be almost invisible on a fresh skin, on the skin of the alive person, or the one who had died few hours or minutes before. But due to evaporation of the fluid, they become very manifested, very prominent in approximately 1 day after the death. And this gives us an understanding that this area was abraded. Abrasion is always an evidence of some kind of physical contact, some kind of mechanical trauma, maybe slight trauma, but anyway, this contact is evidenced by this abrasion. By the way, we don't know what was the object in this case, but don't forget, if something had traumatized this person, maybe this object still bears some flaps of epidermis, some genetic traces. So we have something to look for in this case. And the last picture demonstrates you area of dehydration of the scrotum. Such areas of the human body as scrotum or labia majora in females, they are covered with very tiny skin, moist skin, and that's why they dehydrate fast after the death. In this picture, you see so-called Cadaverous Mortis, one of the most known, well-known early cadaverous change. Cadaverous Mortis is the accumulation of the blood at the below-laying portions of the body. Then the blood circulation stops. Liquid blood, due to gravity, goes downwards. If the body is laying supine on its back, the blood will be accumulated at the lowest position, at the back, at the buttocks. By the way, on the here you can see that scapular region, the region of the buttocks, has no Cadaverous Mortis. That's because these areas were compressed and the body was laying on a flat surface. If the body is suspended, for example, in this case, like in hanging, in this case, we will say formation of Cadaverous Mortis on the lower extremities because the blood will go there. There are 3 stages of formation of Cadaverous Mortis. These stages are hypostasis, stasis, and imbibition. Stage of hypostasis is the accumulation of the blood. It usually takes approximately 8 hours after the death. First Cadaverous Mortis are seen in approximately 3 hours after the death, but the stage of hypostasis is well developed in approximately 8 to 10 hours after the death. This is just accumulation of the blood at the lower portion of the body. The blood is still within the vessels, so if we compress tissue with a finger, for example, or another tool, we will see that this area, compressed area of the liver mortis, becomes pale again because you just push the blood off from the vessels. But in the next stage of stasis, which starts approximately after 10, 11 hours after the death and lasts by 22 hours after the death. Stage of stasis. Then hemolyzed blood becomes to penetrate through the vascular wall to the surrounding tissues and stains these surrounding tissues with a reddish color. So if you compress this stain at that stage, you will see that area becomes pale but did not return to initial color. Then you release pressure, you could see returning of the color of the stain of the blood stain, of livers mortis. And the last stage is imbibition. Imbibition is the stage that blood is surrounding tissues are soaked with blood. The hemolyzed blood saturates surrounding tissues very well, and if you press this area, liver mortis doesn't change the color. What's interesting, if we change the position of that dead body in a stage of hypostasis, the blood will go anyway to the lowest portion of the body. But if we change the position of the body in a stage of stasis and imbibition, for example, we could rotate the body from the supine position to the prone position, or from the prone position to supine position. Livers mortis will stay at the initial portion, for example, on the back, but they also might appear on other opposite surface of the body. So if you see livers mortis on both surfaces, on the front and on the back, this is an evidence that someone, for some reasons, had turned the body few hours after the death. Maybe the body was transported from one place to another to simulate, I don't know, traffic accident or suicide, whatever. One more early cadaverous change is the rigor mortis, postmortem stiffness of muscles. This is the rigidity of all the muscles of the body, including the smooth muscles. This rigidity is due to biochemical changes within the muscles. For muscular activity, optimizing complexes, they need energy. This energy is provided with ATP molecules. As you understand, it's evident after the death there is no production of ATP anymore. So some cells which are still alive within the dead body, the brain is dead, but the muscles are still alive, they could maintain their functionality until they have some energy. And by the way, muscles are not that vulnerable for oxygen insufficiency, like, for example, brain tissues or other tissues. That's why, due to biochemical changes of the environment around these muscles, some dead cells are destructed, ion balance is changed very much. Electric activity of the muscular fibers themselves forces them to contract. This contraction requires all the resources of the organism, of these, not of organisms, but of these muscles. And they spend ATP for contraction, and they have no ATP for relaxation. That's why we see that the muscles, the entire body, they contract, it beats. It doesn't mean that all the body is contracted very much and extremities are bending. No, but the muscles, due to contraction, they become stiff and they cannot relax until the muscular fibers will die. That's why we see rigor mortis formation within the first day, first 24 hours after the death, and then after 24 hours after the death, we see relaxation. But this relaxation is not because of ATP supply, it's because of the death of muscular fibers. And the last early cadaverous change is postmortem autolysis of the inner organs. Autolysis is the destruction of the inner organ by the effect of enzymes, inner enzymes. But in a difference from, if we differ it from putrefaction, in case of putrefaction, we see destruction of the body by the enzymes of bacteria. In case of autolysis, this is a self-digestion, self-destruction of the organs. Not all the organs, but enzymatically rich organs, like glands, predominantly pancreas, thyroid gland, adrenal gland. These glands, they contain a lot of enzymes. And then enzymes are not restricted anymore. They start to digest own tissue of the body. That's what postmortem autolysis is. At this picture, you could see postmortem result of the postmortem autolysis of pancreas. Early cadaverous changes, they help us to understand the fact of death, first of all, to diagnose death with no doubts. Timing of death, we also might understand when the one had died. We also might understand the probable cause of death by the color of the intensity of the liver's mortis and the intensity of the rigor mortis. Tempo of dying process, how fast the one was dying. The brighter liver's mortis are, the faster death process was. We also might understand some additional position, initial position of the body, fact of the changing of position. And we also might understand the relief of the corpse lodge, what was the support and the body was laying on. Delayed cadaverous changes. These are changes which might be seen approximately after 24 hours after the death. We divide them to two groups. Destructive, they include putrefaction and destruction of the corpse by animals, and so-called conservative, preserving, and the body stays relatively solid in one piece, no destruction. These are mummification, lignification, saponification, freezing, petrification, and many other changes which might be natural or artificial. For destructive poisons, now the well-known not the poisons, for destructive changes, the well-known change is putrefaction, decomposition of the body by the effect of the bacterial enzymes. All of us have bacteria in our intestines. These bacteria, they help us to digest food, to produce some necessary vitamins and other substances, but then the one dies. These bacteria are not limited anymore. They are not restricted by the intestinal wall. So they start to penetrate from intestine to the vessels, first of all. And within the vessels, they could find a very useful media for them, which is blood. Do not say that the bacteria are distributed within the body with the blood flow. After the death, there is no blood flow. There is no blood circulation. But the blood itself, as the media, is a kind of nutrient media for bacteria. That's why they distribute themselves relatively easily to all the places of organism. If the body has some putrefactive lesions before the death, like abscesses or cellulitis, it could accelerate putrefaction, could change it. But even these bacteria from the intestine are sufficient for the putrefaction of the entire body. At these pictures, you could see on the left initial stage of putrefaction, greenish coloring of the abdominal wall at the areas which are equal to the location of the right colon and left colon. In the middle picture, you could see the putrefacted venous network. Also, you could see gas formation under the skin, subcutaneous putrefactive emphysema, and within the cavities of the body. And the last picture demonstrates you severe state of subcutaneous emphysema. You could see subcutaneous emphysema of the scrotum and penis, accumulation of the gases within the abdominal wall. By the way, these gases within the abdominal wall and within the abdominal cavity, they could affect the bodies very much, sometimes even leading to ruptures of these cavities. If the body is immersed to the water, these gases might lead to floating of the body, even if the body is fixed to some heavy objects. Putrefaction depends on temperature, depends on aeration, depends on humidity, and of course it depends on initial bacteria, leading bacteria from the intestine or from the environment. We usually see three types of putrefaction. Relatively slow, dry putrefaction, then the body has no enough liquid and the humidity of the environment is low. Moist putrefaction in case of excessive water, like in case of edema before the death, and gaseous putrefaction. This is seen mostly in case if the body had some bacterial lesions before, like abscesses. These bacteria, they distribute faster in case of sepsis, for example, and putrefaction goes very fast, very rapid. In putrefaction, we see such signs as greenish, grayish discoloration of the skin, venous net around the entire body, vesicles of putrefaction. On here you could see them on the side of the chest. These vesicles, they contain odorous fluids, and cadaveric emphysema. This fetid smell, which is felt around the body, is also well known. We will not describe it much. Destruction of the dead body by the animals. I think you understand that different animals, they could destroy dead bodies. These could be wild animals, domestic animals, and some pets. In this picture, would just like to demonstrate to you some examples. First, upper picture on the left. These are damages caused by the insects, ants. On the upper picture on the left, this is cat, typical domestic cat. By the way, these pets, then they are locked in the same apartment to the dead body, and then they are not fitted anymore. They will start eat the human body anyway. Despite these were favorite pets and the victim loved them very much, but if the pet is not fed, if no food is provided anymore, the body will become a food for such pets. And the bottom pictures, both of them, are results of the dogs' skeletonization. The dogs had eaten the dead bodies. Delayed cadaverous changes, conservative one, which maintain the integrity of the body. Mummification, left and the middle pictures. Saponification on the right picture, and lignification. Mummification is a complete dehydration of the body due to evaporation of the fluid, but then evaporation goes fast. Usually the condition must be warm and windy. Good ventilation, fast motion of the air, and warm condition leads to evaporation, and this fluid goes away immediately, so there is no good media for bacteria to grow. And that's why tissues become dry, and they could stay in this dry condition for a very, very long time, hundreds of years. Saponification is another process which usually is seen in a humid condition, the restriction of oxygen. Usually the oxygen is absent, like in swamps, for example. Saponification is the process of the biochemical change of fats. Fats turn to some soapy substance. That's why it is called saponification, soap production. These soapy substances of the fat are not the good media for bacteria, and that's why it stops putrefaction. The body could stay in this condition for a very long time in the swamp, under the water. And lignification. Lignification usually occurs in a medium which is reached some tannic and humid acids like swamps, specific swamps, or it could be artificial. Most of you have seen such a lignification process in a human anatomy department, where the formalin is used to conserve the dead bodies. This formalin takes water from the dead body, dries the dead body, and preserves it from putrefaction. To assess timing of the death, we might use some signs like supravital reactions, Beloglazov sign among them. We might use early cadaverous changes, delayed cadaverous changes, and some biochemical markers. I'm going to demonstrate you a few slides, the information, possible information, which might be helpful in determination of the timing of death. You will see them, fix them. They do not need much explanation. Beloglazov test, as I've said, it is positive already in 10 to 15 minutes after the death and could be seen by 10 hours after the death. Mechanical excitability of the muscles could be seen up to 10 hours after the death. That means if the impact the muscle, some heavy object, we might see a local contraction, idiomuscular contraction, immediately at the area of the impact. Electrical excitability of the skeletal muscles are also seen up to 10 hours after the death. That means that the muscular fibers, most of them, are still alive, are still able to react to mechanical and electrical stimuli. So is the chemical excitability, pharmacological excitability of the muscles. We usually checked it at the iris muscle. We could inject atropine or pilocarpine to the anterior chamber of the eyeball to see if the iris is contracted or dilated due to this chemical effect. Of course, to perform such a test, we need to be confident, we need to be sure that the one is dead already. Do not try to inject this to the chambers of the live people. Early cadaverous changes. Large spots, those spots due to drying on the scleroty occur over 5 to 6 hours. Cooling of the body, rigor mortis, also helpful in this case to understand timing of death. We also might assess timing of death by the changing in case of putrefaction. These are approximate terms. These are approximate terms which usually seen in room temperature condition, in the condition of relatively high temperature, room temperature, relatively low humidity. So it might depend on the circumstances very much. This is also true for the room condition. So today this is the end of the lecture. Thank you for your participation. Those of you who missed the lecture for some reasons, please revise this video one more time. It might be helpful for the classes. Once again, as I've said, welcome to the course of Forensic Medicine. See you in a class. Goodbye.